conventional wisdom in Washington about healthcare reform is that it needs to contain a few things: healthcare, insurance exchange, government mandate that requires everybody to obtain insurance, changes in the tax law, and subsidies for people who can't currently afford insurance. Now, I'm not completely opposed to healthcare subsidies. I'm just not that into them, and that's for a couple of different reasons. First off, whenever you introduce subsidies into the market, you distort that market. Look at ethanol. We've been paying subsidies to ethanol producers for decades, and we're more dependent on foreign oil than ever. And what do we get for our trouble? Well, higher food prices. If you have to do subsidies, somebody's got to set the income level at which those subsidies kick in. And of course that will be the federal government. But that can be a little tricky, because if you set it too low, that discourages people to work. Why should I go out and get a job if I'm going to lose the subsidy for my health care insurance? Set it too high and you have the crowding out effect, or the buying out the base. Which brings me to the Frosts. And they were a family that gained some fame a few years back when congressional Democrats decided to use their family's 10-year-old son to illustrate the benefits of a then pending expansion of the state children's health insurance program, S-CHIP. Now, aside from the fact that it's just appalling that a grown political party would use a little kid to push its agenda, I mean, geez, next time why don't you just use a little teddy bear from the fabric softener commercial? It turned out that the family was actually pretty well off. They had 4 kids who attended private school through scholarships, but still, it was a $20,000 a year school. Both parents worked. The father had his own company that owned a commercial building worth about $160,000, and the family lived in a 3,000 square foot house in a neighborhood with comps in the range of $500,000. Now, I don't begrudge those people that nice setup. I just don't think they should get the taxpayers to pay for their insurance. If we do subsidies, they should be means tested and asset tested. I want people to understand that it may not be fun to spend a lot of money on health insurance premiums, but it should be a priority. I am fine with helping somebody out through a rough patch. I am not fine with helping somebody maintain their lifestyle. Sure, subsidies help some people, but they also encourage others to game the system at the expense of other people who have enough self-respect to pay their own way.